For 50, 60, 70 years, your body has been a faithful companion. It's carried you through life's greatest joys and weathered every storm. But what happens when it starts sending you signals you don't understand? A persistent ache that wasn't there last year, a cough that decided to move in and won't leave, or a quiet feeling deep down that something is just off. Hello, I'm Dr. Sarah Collins. For years in my clinical practice, I've listened to the stories patients tell me, and more importantly, the ones they've been trying to ignore. Too often, we dismiss these critical signals. We tell ourselves, I'm fine, or it's just part of getting older. Today, we are going to change that. We are going to have an honest conversation about the serious red flags your body sends you, the whispers you cannot afford to ignore, so we can replace fear with the power of knowledge. Before we even get to the red flags, let's talk about the wall so many of us build. The wall of I'm fine. It's built from bricks of I don't want to be a bother, or it's just a little pain, it'll go away, or my personal favorite, I'm too busy, I'll deal with it next month. Sound familiar? I once had a patient, let's call him Robert, a 68-year-old grandfather who loved his garden. He'd had nagging lower back pain for 6 months. He was taking over-the-counter pills, using heating pads, and telling everyone he was fine. He assumed he'd just overdone it with the weeding. But the pain was different. It woke him from his sleep. He'd started losing weight without trying. These were the whispers. By the time I saw him, the whisper had become a roar. The pain wasn't a muscle strain. It was from a tumor pressing on his spine. Robert's story is why I'm making this video. Most conditions, from heart disease to cancer, have the best outcomes when they're caught early. We have to learn to listen to the whispers. So let's tear down that wall, brick by brick. I've grouped these signs into 5 main categories. If you experience any of these, it's not a suggestion to see a doctor. It's a demand from your body for attention. Red flag number 1, the Thunderclap event. This is anything that is sudden and severe. Imagine a thunderclap in a clear blue sky. It's not a gradual change, it's a dramatic, immediate crisis. This includes the worst headache of your life. Not a tension headache, but a sudden, explosive pain that feels unlike anything you've ever known. This could be a ruptured brain aneurysm. It also includes sudden weakness, numbness, or paralysis, especially on one side of your body. A drooping face, slurred speech, or sudden loss of vision are hallmark signs of a stroke. Then there's chest pain. The classic elephant on the chest is one sign. But for many, especially women, it's pressure, squeezing, or severe indigestion that won't quit. It can travel to your arm, jaw, or back. And finally, a sign so often missed, sudden confusion or a dramatic personality change. One moment, your loved one is themselves, the next they don't know where they are, their words are jumbled, or their personality seems to have vanished. This is a neurological emergency. For any thunderclap event, you do not make an appointment. You call for emergency help immediately. Time is brain, time is heart, time is life. Red flag number 2, the unexplained ledger. Think of your body as a finely tuned financial ledger. When the balance is thrown off without reason, it's a major red flag. I'm talking about unexplained weight change. Losing 10 or 15 pounds without changing your diet or exercise might feel like a victory, but it can be a sign of an overactive thyroid, diabetes, digestive disorders, or even cancer. Conversely, gaining weight while your habits remain the same could signal that your body is retaining fluid due to issues with your thyroid, kidneys, or heart, which is a very serious sign. If your body's internal ledger is out of balance, don't guess why. Go and get it audited by a professional. Red flag number 3, the symptom that won't quit. This is the unwanted guest who overstays their welcome, a symptom that lingers for weeks, not days. We are programmed to think things will get better on their own, but sometimes they need help. Examples include a persistent cough or hoarseness that lasts more than 3 weeks, a low-grade fever that won't break or keeps coming back, a sore anywhere on your skin that doesn't heal, or a mole that changes shape, size, color, or starts bleeding. And this touches on my own specialty, a change in your bowel or bladder habits. People are notoriously shy about this, but a persistent change, like blood in your stool, chronic diarrhea or constipation, black or tarry stools, or feeling you can't fully empty your bladder is not normal. It could be a simple hemorrhoid, but it could also be the first clue of colon or bladder cancer. Don't let a moment of embarrassment risk years of your life. Red flag number 4, short circuits in the system. This category is about your brain and your senses when the body's wiring seems to get crossed. This isn't always as dramatic as a thunderclap stroke, but it's just as serious. Pay attention to persistent dizziness, new onset clumsiness, or trouble with your balance that makes you feel unsure on your feet. Or unexplained, persistent fatigue. I don't mean feeling tired after a long day. I mean a bone-deep exhaustion that doesn't improve with rest, where you feel like your battery is at 10% no matter how much you charge it. Other signs are changes in your vision, like ongoing blurriness, double vision, or seeing flashing lights. Or memory problems that go beyond misplacing your keys, like forgetting the names of close relatives or how to do tasks you've done your whole life. These short circuits can signal anything from severe anemia and vitamin deficiencies to serious neurological conditions. Red flag number 5, the nagging whisper. This last one is the most important and the hardest to define. It's that gut feeling, that nagging sense in the back of your mind that something just isn't right, even if you can't explain why. It might be a new type of pain. It might be that you just feel different. You are the world's foremost expert on your own body. You've lived in it your entire life. You know its rhythms. When your instinct tells you that something has fundamentally changed, that a new, unfamiliar noise has started, listen to it. So many patients, after a serious diagnosis, have told me, "You know, doc, I knew something was wrong for months. I just didn't want to admit it." That feeling is your body's most fundamental alarm. It's a quiet whisper, but it's the most important one you will ever hear. Please do not ignore it. Okay, that's a lot of scary information. Let's take a breath. The point of this isn't to make you anxious. The point is to make you an active partner in your own health. So if one of these flags resonated, what's a smart plan? First, write it down. Before you even call the doctor, grab a notebook. When did the symptoms start? What does it feel like? What makes it better or worse? Does it happen at a certain time of day? A detailed history is the most valuable tool you can bring to an appointment. Second, make the call. Just do it. Today. That is the hardest step and the most crucial one. It's always, always better to find out that it's nothing to worry about than to wait and wish you had checked sooner. Third, be honest and be prepared to be a partner. Your doctor is not a mind reader. Be brutally honest about your symptoms, your fears, and your lifestyle. Yes, that includes how much you drink, if you smoke, or how that slice of cake every night has become a habit. We have heard it all, I promise, and we are not there to judge you. We are there to help, and it's a two-way street. Ask questions. If you don't understand a word, stop your doctor and ask them to explain. If you're worried about a specific diagnosis, say so. This is your health. You are the CEO. We are your most trusted consultant, but you are in charge. Seeing a doctor isn't an admission of weakness. It's an act of profound strength. It's an act of love for yourself and for the people who need you. Your body is the house you've lived in your entire life. You know its every creak and groan. Don't ignore it when you feel a crack in the foundation. Don't wait for the whispers to become screams. If this video made you think of a specific ache, a persistent worry, or just that nagging feeling, please make that call. Do it for the person you are today and for all the tomorrows you deserve. Thank you for listening. Be well and take care of yourselves. Your future self will thank you for it.